All right, so this is part two of my day. I had to answer my wife's phone call. Again, today is December 21st, 2020, excuse me. All right, where was I? So, next patient I saw. Interested patient, post-op, 2-week post-op, status post right L3, 4, and L4, 5 laminotomy. So before I even get in the room, the nurses will normally take out the post-operative staples. So I go in there, actually the medical assistant, and she had removed it, but the very top or superior portion of the incision was kind of dehisced, like, I don't know, about an inch of it, right? I'm looking at it, I'm like, yeah, it doesn't look right. So as soon as I saw that, I said, okay, well, let's get some cotton-tipped applicators, which is basically a Q-tip, big long Q-tip, one-sided instead of two-sided. Um, so I had to get me some of those, and I dipped them both in some peroxide, and I just slightly pushed it into the little dehisced or open part of that incision at the superior part, and it shot out at me. A bunch of serous, bloody serous fluid shot out. I got on my jacket, got on my shoes, all over the floor. Good thing I had another clean jacket. Um, and so he had what we call a postoperative seroma, or a collection of postoperative fluid, usually kind of some blood tinged, serous fluid. Okay, there was no sign of any infection. All right, I proceeded to kind of explore it a little bit, and actually it was deep for about, I would say about 2 inches long, deep, and then I could also track superiorly for about 3 inches, and that was pretty significant. So I went and got my supervising physician, let him take a look at that, because sometimes they look at that and they say, oh, I'm going to have to open that up, and we're going to have to close that intraoperatively or something like that. But Dr. Butler, I know, doesn't really like to do that. He likes to be more conservative and wait and see if it heals prior to recommending any further surgery. So that's what we did. We didn't pack it or anything. We just put a nice pressure dressing on it. Told the patient to keep it covered. I did put him on an antibiotic prophylactically, just because there is an opening into the soft tissue there, and I didn't want to take a chance of him developing any type of postoperative infection. So I did that. And after I punctured this seroma, his back felt much better. His leg pain was resolved postoperatively, but he had some back pain still. But that was much improved after I punctured this seroma. So, okay, so who was next? All right, this young guy, 33 years old. He is about 6 weeks status post a 2-level anterior lumbar interbody fusion at L4, 5, and L5S1, and posterior decompression and fusion. He is a workers' comp case that we have been dealing with for almost 3 years. It took over 2 years to finally get the surgery approved. We proceeded with the surgery, and he's probably today, speaking with him, about 50% better than he was prior to the surgery, and just gradually, slowly improving. But that's a big surgery for a young guy. But he is doing well. I'm very pleased with that. So, next patient was here for her 2-week postoperative appointment. She was status post C5-6, C6-7, ACDF. That's an anterior cervical discectomy and fusion. She was actually doing very well. Hold on a second. It's my wife. Hello. All right, hold on. Let me